Hey guys, so welcome back to the PSM session again. So in this particular session now we will be talking about yet another important topic, that is the determinants of the health determinants, and we'll be talking about the important indicators, right? So let's begin with that. So in the health determinants and indicators, first of all we should know the important indicators. So there are several important indicators, okay, and the examiners are targeting those indicators. Okay, so we'll be knowing about those kind of indicators, but before that let's understand what is indicator, right? So basically this indicator means some target, right? So we are thinking about some target, right? So we are having some target in the mind. Okay, so that is basically the target in the space is the indicator in a simple term, right? So first of all, so very first question, that what is indicator, right? That is the very first question. So indicator is nothing but target, right? Target in the space, right? Basically these are the mid-term milestones. That's what book says. These are the mid-term milestones. Okay, fine. So there are several kinds of indicators they are telling. Okay, now there is one more important term which we need to understand, that is the index. Okay, that is index. So what is this index now? If you will combine all the indicators, I will tell you what are different indicators. If you will combine all the indicators, that will become the index. Very simple, right? So this is basically the composite amalgamation, right? This is basically the composite amalgamation of indicators, right? If you will combine all the indicators, then it will become index. Very simple. For an example, I will give you very simple basic example. For example, some of you might be having some knowledge about the stock market, right? So in the stock market, what we are having different kinds of stocks, right? Different kinds of stocks. They are having the companies and all, right? For example, Reliance company or some Tata company or like that, etc. Okay, so different stocks are there, right? You might be hearing about the Nifty 50 or the Sensex, right? So if you talk about the Nifty 50 is the index, right? And what I told you, index in our case is the composite amalgamation, or it is the sum up of indicators, right? In the stock market, index, for example, Nifty 50 means it is the amalgamation of the 50 stocks. It is the sum up of the top 50 stocks. So if you will combine all the stocks, that will become index, right? That is just to highlight the example, right? So in that case, we are talking about that index, Nifty 50 index means sum up of the stocks. Here we are talking about index, sum up of the indicators. Okay, very simple to understand. Now let's talk about the different indicators. Okay, so first of all, different kinds of indicators, right? So I shall write types of indicators. Okay, so I shall write over here types of indicators. Okay, types of indicators, right? So we are having several types of indicators. So among that, first one is the mortality indicator, right? First one is our mortality indicator, right? Mortality indicator, basically it is telling about the deaths in the community, right? This is the basically death indicator, right? So this is basically your death indicator. Fine. Then second one is the morbidity indicator. And usually it is telling us about the sickness in the persons, right? Sickness in the community. So it is the basically indicator of sickness, right? So it is the sickness indicator. Okay, sickness indicator. Don't worry, we'll talk about these in detail. Okay, sickness indicator. Then third one is our utilization indicator. That how well the person, how well the population is actually utilizing their services. For example, the government of India launches several kinds of schemes, right? how well the people are utilizing those schemes, right? So the government of India have opened up the government hospitals, government PHC, government CSC, how well the people in that particular society or that community are using those facilities provided by the government, right? Okay, now that is this thing. So it is practiced by the population, right? Now fourth one, after the utilization indicator, we shall talk about the service indicator, right? We shall talk about service indicator, right? Service indicator. In the service indicator, we shall talk about the facilities which are provided by the government side, right? So the facilities which are provided by the government, facilities provided by government, they are actually service indicators, right? Then next we are having, that is the socio-economic indicator. Okay, socio-economic indicator, fine. Socio-economic indicator. Okay, this is the very important one, right? Among all the indicators, socio-economic indicators plays a very important role. Now then we are having a disability indicator. Disability indicator, fine. Disability indicator. And then the next one we are having the health or development indicators. Health or development indicators, right? So you might be thinking, so many indicators we are having, right? So usually the questions will be coming the components, like different components I will be telling you among all these indicators, right? They will be telling you which of the following is not a component of this particular indicator, or which of the following is a component, or which of the following is a part of this particular indicator. These kind of questions are actually coming, and we'll talk about them as well. Okay, so don't worry about that, just be with me. So over here I'm just starting with the very first one, that is the mortality indicator, right? So let's talk about the mortality indicator now. So first one we are going to talk about over here, that is the mortality indicator. Okay, so first one I'm starting over here, that is the mortality indicator, right? And as I told you, it is telling us or giving us the idea about the death, right? So this is the death indicator, first question. Second one is here we are having, in this we are having the subcategory. One is the universal indicator in this, and another one is the maternal and the child indicator. Okay, what do I mean by that? So universal indicator, these are having two subcategory, universal indicator, right, and the maternal and child indicator. Maternal, that is related to mother, and child indicator. Okay, now for example, let's start with the universal indicator only, right? So in the universal indicator, what kind of indicator? Mortality means death. So in these indicators, very simple to understand, either the mortality word will come, either the death word will come, right? In these, among these indicators, for an example, it is carrying the crude death rate, right? How the question will come? Which of the following is not an indicator in the mortality indicator category, right? So in the options, you just need to look for the death or the mortality word, and rest of your job is done very beautifully. Only some indicators are there in which you need to remember something, but otherwise either the death word is coming, either the mortality word is coming. So look over here, crude death rate. Here, age specific death rate, age, again death rate came, right? Age specific death rate. So here is the trick. That's how you can just remember these indicators, right? Then disease specific mortality rate. Disease specific, again which word came? Mortality. So mortality means death, mortality. Okay. Then case fatality rate. Fatal, very dangerous, right? So like that you can remember case fatality rate. Then you can remember adult mortality rate. So again which word came? Mortality, adult mortality rate. So very simple actually to remember all these things, right? Then we are having the proportional mortality rate, right? Mortality rate. So again very simple to understand, isn't it? Then we are having next one, that is the, now this is somewhat different, that is a life expectancy. So technically only This you need to remember, that life expectancy is coming under the mortality indicator. These are the universal indicators. In the maternal and child indicator, the word is only telling you, right? What they are saying, maternal and child indicator. For an example, infant mortality rate, maternal mortality rate, isn't it? So I can write the example over here. For example, maternal mortality rate. Again, which word is coming, guys? Mortality in this. Maternal mortality rate. Then infant mortality rate, because I am talking about maternal and child. Infant mortality rate. Okay. Then what else you shall talk about that? Under 5 mortality rate. The children who are actually under 5. So under 5 mortality rate is also coming. Under 5 proportional mortality rate. Proportional. So U is sign for under. Okay. Under 5 proportional mortality rate. Mortality rate. Okay. So these kind of rates are actually coming under this, right? Then you shall add child death rate, child mortality rate or child death rate, okay, accordingly. So these all are indicator are actually coming under which category? That is the mortality indicators, right? Very simple to understand. Just remember the mortality and the death word, okay? So in almost all these indicators, okay, almost all the rates are having the mortality or death in them, and it is very easy to recognize also, right? Now, so by the help of these rates, we are actually determining the mortality rate. Okay. So according to the UNDP, United Nations Development Program, according to the UNDP, they said that for India, okay, for India, they had their information in the 2021 I am talking about. So life expectancy came out to be about 69.7 years. Life expectancy tells you that how many years a population is living in an average. So for India, it came out to be 69.7 years, approximately 70 years. The Indian population is actually generally on an average, the people are having a life expectancy, or they are actually living their life for about 70 years on an average. Some people might die before the 70 years, some people might die after the 70 years also. So this is on an average data. So United Nations Development Program, okay, they actually came up with a figure that is the 69.7 year. This is the average life expectancy for India. So that can be asked actually in the questions. That's why I'm telling you. So life expectancy, just writing the LE, life expectancy is 69.7 years, right? And that I'm talking about in the 2021. So okay, for the 2022, obviously it didn't came because we are in the 2022 as per date if I'm recording this particular video. Okay, now we shall talk about if I'm talking about life expectancy, if you talk about India, it is 69.7 years. Okay, maximum life expectancy and minimum life expectancy is seen how much? Maximum is seen in the Hong Kong. And it is around 84.9 years, around 85 years. Okay, that is very much, right? And 52 to 53 years is the minimum life expectancy. Okay, now next point is mortality indicators are done. They are telling you about the death. Okay, these are the death indicators. Now I'm coming to the next one, second one, that was morbidity indicator. So let's talk about that as well. So second one is the morbidity indicator. Morbidity is telling you about sickness, right? So morbidity indicator. Okay, so let's talk about that as well. Now in the morbidity indicator, we are talking about very important two factors. These are the incidence and the prevalence. Okay, however, we are having other factors also. So let's talk about them as well. So we are talking about mainly incidence and prevalence. Okay, what do I mean by that? Incidence is telling you total number of cases per unit time. Cases per unit time, right? And prevalence is telling you the old plus new cases. As well in a community. Old plus new cases, prevalence, total number of cases per unit time, that is the incidence, right? Now over here some other factors, for example notification rates, right? These are actually direct questions. okay, in the several examinations. So notification rates, if they're asking you, again coming under which indicator, these are the morbidity or the sickness indicator, right? Notification rate is actually telling you how many people are actually getting the sickness or how many people are getting the disease in the population. So that is the notification rate. Notification rate is telling you people getting the disease, how many people are getting the disease, getting sickness. That is which indicator? Morbidity indicator, obviously, notification rate. Okay, then next one is your, okay, fine, next one is your admission rate, admission rate, readmission rate, right, discharge rate. Okay, these are all coming in the morbidity indicator, right? So it tells about the burden of the disease on the population or burden of the disease on the society. So it tells us about the burden of disease in the society. It tells us about the burden of disease in society, burden of disease in society. Okay, again we are talking about sickness, we are talking about disease. Which indicator? Morbidity indicator. Till now, incidence, prevalence, admission rate, discharge rate. For example, you can add discharge rate as well. Admission rate, okay, discharge rate, okay, tells about the burden. And the notification rate we have talked about, right? Then duration of stay in the hospital or average length of stay in the hospital, duration of stay in the hospital. Okay, duration of the stay in the hospital, and it tells us about the chronicity of the disease in the society, how chronic the disease is, right? For how much time the person was in the hospital, for an example, right? So duration of stay in the hospital. So it tells us about the chronicity nature. So it tells about the chronicity of the disease in society, chronicity of disease in society, right? Okay, now we shall move further and we shall talk about next indicator, that was our utilization indicator, right? So let's talk about the utilization indicator. Third one is the utilization indicator. Utilization indicator, right? Again, how the questions, okay, what is the importance of knowing all these things, right? So importance is that in the morbidity indicator, they might ask you this, for example, notification rate is a component of which indicator? Then your answer should be morbidity indicator, right? These many people are admitted in the hospital. What indicator we are talking about? Morbidity indicator, right? These many people are discharged from the hospital. These many people were actually admitted in the hospital for 14 days. Okay, they are talking about average length of stay in the hospital, duration of stay in the hospital. Which indicator? Morbidity or sickness indicator, right? So these kind of question might be asked by the examiners, right? Okay, now utilization indicator, how well the people are utilizing the services provided by the government. Okay, that is your which indicator? Utilization indicator, right? So again, very important. So here we are talking about, for example, several kind of immunization programs are actually running by the government, right? So immunization programs, that could be the example. Okay, immunization, right? Immunization rates, how well the immunization rates are actually going, how well the people are how frequently the people are coming actually for the immunization programs for their child and all, right? Then how well the people are using the PHCs, CHCs, how well the people are using the hospitals and all, government hospitals and all, right? So these kind of things. So how well the people are actually using the PHC or the community health center. Okay, how well the usage. Okay, how well the people are actually using these things. Okay, then we are having the concept of bed occupancy rate. That is also coming in this category. Bed occupancy rate tells us, it's a very important indicator basically for the utilization of the healthcare facilities, I will say. So bed occupancy rate is actually telling us that if some person was actually admitted in the hospital, okay, and then for how many days this person was actually had the disease and he was actually occupying that particular bed. Okay, so that is the indicator which is telling by the bed occupancy rate. Okay, so it is basically telling us that utilization of the healthcare facility. Okay, this is the important indicator. So this is the important indicator. Okay, right. So I was talking about the bed occupancy rate. So bed occupancy rate here, this is the important indicator, right? This is the important indicator for utilization of healthcare facility, for utilization of healthcare facility in the population. Healthcare facility in the population, right? Then next one is the bed occupancy rate is done. Next one is the bed turnover rate, right? So next one is the bed turnover rate. Now bed turnover rates basically tells us is an important indicator for the efficiency of healthcare facility. Important indicator for efficiency of healthcare facility. Efficiency of healthcare facility, right? So usually how they are asking the question, best indicator for efficiency of the healthcare facility, then your answer would be bed turnover rate. But if they're asking you best indicator for utilization of healthcare facility, there is difference, utilization and efficiency, right? So for the utilization, if they're asking, then bed occupancy rate. Okay, so be very clear with that. And they're coming in which particular indicator? That is the utilization indicator, right? Now I'm moving on to the next indicator, guys. That is the fourth one. Okay, and that is your service indicator, right? Services which are provided by the government. Okay, service indicator. So in this we shall talk about the public health indicator. Public health indicator, right? Public health indicators, right? In this one we shall talk about what is the ratio between doctor and population, doctor and nurse ratio, right? So these kind of ratios we are talking about. So I shall write over here, for example, doctor nurse ratio, right? Then doctor population ratio, right? Doctor population ratio, right? Then we shall talk about the the bed supply rate, bed turnover rate, and the bed occupancy rate. I told you in the utilization indicator, but here I'm telling you about the bed supply rate. Okay, bed supply rate, if they're asking you which indicator, then it is the service indicator, right? So this is the thing. So public health indicator is telling you that doctor nurse ratio, doctor population ratio, or let's say health center and the community ratio, right? For example, in one particular society there was health center, right? So to that health center, what is the ratio of community? So health center and the community ratio, that is also coming in this category only. So health center and community ratio, or society ratio, whatever you want to call it, right? So these are coming in the service indicator, how well the people are actually going that, or for example, doctor and the population ratio, right? So let's say per 10,000 number of people, how many doctors are actually available, right? That is the doctor community ratio. Okay, then we shall talk about next indicator, that is the socio-economic indicator, right? So let's talk about the socio-economic indicator also. So socio-economic indicator, it's a very important indicator among all the indicators, right? So this is the socio-economic indicator, right? In the socio-economic indicator, we are talking about the development of the area, right? So how well the area is actually developing, social and the economical, both factors, right? So socio-economical factor. So socio-economic factor indicator, it tells us about basically, right, the development of the area, right? Tells us about the development of the area, right? Development of the area, and which kind of rates we shall talk about over here. For example, we can talk about the calorie per capita. Okay, these are the things which are actually included under this, right? So calorie per capita, the family size, right? Family size, the growth rate. Okay, what is the dependency ratio, what is the literacy rate? Okay, all these things. So dependency ratio, how how many people are actually dependent on somebody, right? The population which is depending on somebody, right? So dependency ratio, right? Then literacy rate, growth rate. Okay, so literacy rate, right? So that is the thing, right? Now in the literacy rate, we shall talk about two important factors, right? Two important things. Usually they ask you. Now, two things are there. One is the literacy rate. One is the effective literacy rate, right? We know the maximum literacy rate in India is actually, that position is carried by the Kerala, right? So there the persons are having, the Kerala population is having the highest literacy rate among our country, among India, so among all the states. So over here, two terms are there. One is the literacy rate and another one is the effective literacy rate. So we shall know the definition also. For example, if you talk about the literacy rate, then literacy rate says, right, literacy rate says that the number of adults, right, number of adults who can read and write, right, number of adults who can read and write in any kind of language. Okay. For example, the language could be Hindi, language could be English, language could be Punjabi, language could be anything, right? If an adult can read or write that language, okay, read or write in that particular language, and the age is more than 15 years, then it is called as the literacy rate, right? So an adult who can read and write, adult who can read or write in any language, right, more than 15 years. Person age is if it is more than 15 years, right? If same definition I will be keeping, and for age I will be telling more than 7 years, right, just half of it, then it becomes the effective literacy rate. Okay, then it becomes the effective literacy rate. Okay, and we'll multiply it with 100. Okay, same with the effective literacy rate also, that what we'll do. So here I can write the effective literacy rate also. Effective literacy rate, it is also coming under which category? That is the socio-economic. So question comes usually, they might tell you even the definition, that difference between the literacy rate and the effective literacy rate, right? So first a population should be having literacy rate, and then the effective literacy rate comes, right? That even a 8-year-old boy, okay, knows how to read or write some particular language. That tells us about the effective literacy rate, right? So an adult, okay, not an adult now, I would say any kind of child or any people. Okay, so the number of people, I would say rather, so number of people who can read or write, number of people who can read or write in any language, what should be the age? More than 7 years. Okay, multiplied by 100, that gives us the effective literacy rate. Okay, now understood. Now we are talking about, now we are coming to one more important indicator, that is the disability indicator. So next indicator now we shall talk about. So we had talked about fifth one, now we are coming to the sixth indicator, that is the disability indicator, right? Disability indicator. In the disability indicator, we shall talk about a very important term, right, in the disability indicator. Okay, so in the disability indicator, we are talking about several kind of disabilities, right? Here basically two types are there. One is the person type, right, that the person is having some kind of deformity, or due to the disability the person is not able to perform some function, perform some work, right? Other one is the event type, that for example the person is feeling lazy, right? Sometimes you are not feeling to study, right? So due to that you are not doing any kind of work, right? So that is the event type disability, right? So two types of disability they are defining, that is, one is the person type and another one is the event type. So I'm writing that only, that one is the person type disability and one is the event type disability. One is the event type disability. Okay, now right, so we were talking about the disability indicator now. Okay, so in the disability indicator, I was talking about that there could be two scenarios. One is the person type disability and another one is the event type disability. So basically, I will try to compare these two, right? So in the person type disability, okay, usually the person is having some kind of disability, right? So the person is disabled. So here the person will be disabled. The person will be disabled, right? And here in this case, in the event type, basically the person will not be having the mood to work, right? Sometimes you're not having the mood to study, for an example. So that is the event type disability, right? So in the event type, the person is not having the patient is not in that mood to work, right? So that kind of disability will be the event type disability, right? So here we can write in the event type there is a mental disability, or the patient is not having the mood to work. So that is the thing. So patient or the person not having the mood to work, right? In the person type again, in the person type, here the due to some kind of disability, right? The person is getting disability. Due to that kind of disability, the person will not be able to perform his or her activity, right? So in that case, we can say that mobility will be limited, right? Any kind of activity will be limited. So you can see that limitation of limitation of mobility or activity, limitation of mobility or activity. Okay, in this case, in the event type, further in the event type, if I will extend this line, right? So in the event type, further you can say that number of days of the restricted activity. So we are talking about number of days of restricted activity. Why is it so? Because the person is having which kind of disability? Event type. I told you already that the person is physically stable but not mentally, right? So if the person is physically unstable, that is the person type disability, and on the other hand, if the person is mentally unstable, then that would be the event type disability, right? So here the mental disability will be there. Mental disability will be seen. Okay, now let's move further, right? And now I'm going to talk about three very important scenarios in the disability indicator only, and that is tested very, very frequently by the examiners, right? And what is that? These are three important parameters, right? One is the impairment, another one is the disability, and the third one is the handicap. Okay, so let's talk about them as well. So impairment, again we'll try to compare these three: impairment, disability, and handicap. So listen very carefully as far as these three important topics are concerned, right? Impairment, disability, and handicap. Okay, so impairment, if you will talk about, this is the anatomical loss for some kind of person or patient, right? For it could be anatomical loss or it could be physiological loss for the person, right? So if you talk about the impairment, this is the anatomical loss or the physiological loss. What do I mean by that? Let's say some kind of person are unfortunately met with the accident, right? And okay, due to that accident, the person let's say lost the limb, or the person had the stroke, for an example, right? Or the person had some kind of disability due to that, right? So for an example, the person is having the hemiplegia, right? For example, the person is having the hemiplegia, or the person is having quadriparesis, let's say, right, due to any reason. Now this is the impairment, right? Or some person is unconscious after the road traffic accident, right? So this unconsciousness, or I can say the impaired consciousness, right? So there is impairment of consciousness. So impaired consciousness, these kind of terms we are using in the hospital settings as well, right? These kind of terms are used by the clinicians in the hospital settings. So this is considered under which category, guys? Impairment, right? So impairment is a term which is used by the clinicians in the hospital settings. So that is impairment. So clinical criteria I can write over here as well, okay, that it is this kind of impairment, this kind of terminology used in the hospitals by the clinicians. Okay, this is impairment. Now if you talk about the disability, here the person will be having the loss of activity or loss of action due to that impairment, right? So these terms are related to each other. First of all, there will be impairment. Due to the impairment, the person will be having disability. Due to the disability, the person will be having the handicap. The person will be handicapped. Okay. So in the disability, we are generally saying that the person will be having the loss of activity or loss of action. Loss of activity or action. Right? The person is disabled. In the handicap, so due to the impairment, disability happened. Due to the disability, the handicap, the person will be handicapped basically, right? So in the handicap, we are saying that the person will not be able to perform the duties as far as socially. If I will be saying that person is handicapped, so I can understand that this person is actually not qualified for the social works. Okay, or I can say that the person will not be able to get the job, for example. So let's say this example only, the person had the quadriparesis, right? Due to this quadriparesis, the person will not be able to do his or her functions, right? He will not be able to move the limbs, right? So functions will not be able to, performed. Then after that, how the handicap is there, how the handicap component comes in. So in the handicap, we are saying that due to that quadriparesis, the person will not be able to get the job, or if the person had the job, the person might lose the job, right? Because that person is not able to his or her limbs, right? So let's again talk about this. The person was there. Let's say the person had the quadriparesis, right? This is the impairment, right? This is the impairment that the person is having this physiological loss or the anatomical loss. Here the person is having the physiological loss. That person is not able to move the limbs, right? This is the impairment. Now, then comes the disability. So here the person will not be able to perform the activities, right? For example, lifting something or giving something to others, right? So these kind of activities, the person will not be able to do so. Then due to this disability, the person will be handicapped because the person might lose the job due to this particular deformity, or due to this particular impairment or disability, the person might lose the job. So that will be the handicap. So for that purpose, the government is having the handicap quota as well, right? So you know about that as well. So these kind of terms, handicap term, usually used for the quota purposes. For example, handicap quota, right? So here I can say in the handicap, the loss of social role, or the loss of occupation, or the loss of job, right? Here I shall talk about the example, which is your handicap quota, right? Handicap quota, right? So this is the thing, right? So this is the social phenomena, right? So this is the important difference between the impairment, disability, and your handicap, right? So I hope you got the difference. Now I'm moving on to two important terms now in the disability indicator only. These are, so in the disability indicator only, we are talking about two important terms, disability indicators. Okay, so we are still talking about the disability indicators. It's a very important indicator. In the disability indicator, I'm going to talk about two more further terms, and this is, one is the QALY, QALY, right? QALY, and another one is the DALY, DALY. So what are these terms, QALY and DALY? QALY means quality adjusted life years. Okay, what do I mean by that? Quality adjusted life years. Okay, as the name suggests, okay, I'm coming to this. And DALY, disability adjusted life years. Disability adjusted life years. Okay, so here what you can understand, very easy. Look at the QALY. QALY means, the name is suggesting that quality adjusted life years, the number of years a person has lived in the quality, right? For an example, let's say that a person was supposed to live 70 years. The person was supposed to live 70 years. Okay, this is 0 and this is 100. A person was supposed to live 75 years, let's say 75 years. Okay, 75 years. And let's say the person was completely in a healthy state. I told you the definition of the health as well. Health is a state of physical, mental and social well-being, and not merely an absence of disease, right? only the absence of disease, you can't say this is health. Health is a combination of, yes, the person should be disease free as well as the person should be in a state of physical, mental and social well-being. So let's say the person was completely completely healthy, right? The person was not having the disease, the person didn't feel any need to go to the hospital or to the doctor, let's say, right? The person was living a healthy lifestyle till the age of 70 years, or I would say till the age of 60 years. Till the age of 60 years, the person was healthy. So this is the period which you can say QALY, means the person has lived the quality of life. That is the quality adjusted life years, because he was disease free, basically he was healthy in that particular time period. So that particular time period will be termed as the QALY, that is the quality adjusted life years. I hope that you are clear with that. Okay, so that is the thing. So what do I mean by quality adjusted life years, guys? Now you can easily answer. So this is the parameter where you can measure quality of life. Measure quality of life. Okay, second important point over here is this is the indicator of cost effectiveness of the intervention. What do I mean by that? Indicator of cost effectiveness of any kind of intervention. Okay, for an example, the person became diseased after the 60 years of age, right? The person became diseased after the 60 years of age, and due to the intervention of somebody, it could be the intervention of government. For example, the person had the diabetes, or the person had the TB, let's say, at the age of 60 years, right? Now the government of India is having the schemes, right? Several kinds of scheme. For example, DOTS for the as a treatment modality for TB patients, right? So if any kind of person is taking the help of that intervention, right? So he is getting benefited. So he might actually increase his lifespan, right? So that is called as the intervention. So it is the best indicator for cost effectiveness of the intervention. Next point over here is that it can be actually expressed as either 0 or either 1. Expressed as 0 or 1. Generally we are saying, if we are talking about 1 means perfect health. 1 means perfect health and 0 means death. Okay, if you talk about quality adjusted life years is done. If you talk about and compare the disability adjusted life years, okay, disability means the number of years the person might have spent in the disability, right? That is the disability adjusted life years. Or the person might have spent or the person might have died prematurely, right? For an example, again I will take the example over here again, guys. So look, let's say this is the lifespan, this is the life expectancy, 0 to 100. Okay, let's say again same person, let's say the person had to live naturally 75 years. Okay, generally just taking an example, let's suppose the person had to live his life 75 years. Now let's say the person had some kind of the person met with some kind of accident, okay, and due to that accident the person started having the seizures. And person became the patient of epilepsy, right? Multiple episodes of seizures the patient started having, and he went to the neurologist, and the neurologist started this patient on the anti-epileptics, right? Now that means what? So before the accident the person was healthy. Let's say at the age of 40 years, the person met with the accident, and repeatedly the person had the episodes of seizures, right? So till this point of time, if I will say, right, this was the quality adjusted life years. But after that what happened? The person started having seizures, and person started on anti-epileptics, and let's say unfortunately at the age of around 60 years this person died due to complications. This person died. Okay, so here we can see two components. One component is this one, okay, 40 to 60 years, when the patient was on actually the anti-epileptics, and somehow or other person was managing his life. But after that he actually died before his normal time, that was 60 years. right? So 60 to 75 years he has lost this much time, that is around 15 years he had lost completely, right? And 20 years 40 to 60 he has lost partially because he was living in the disease and all. Okay, so that is the thing. So here we can see two components. So here comes important subcategory in the DALY, because DALY is a combination of disability adjusted life years, a combination of years lost to disability plus years lost to life. What do I mean by YLD and YLL? I'm just writing over here. YLD, I mean years lost to disability, years lost to disability, and YLL means years lost to life. So here in this scenario, in this example, what is YLL, guys? Years lost to life. This is the years lost to life, and this is the years lost to disability. Are you understanding? Because at the age of 40 years, the person started throwing the seizures and the person became the patient of epilepsy. Now in this particular period, 40 to 60 years, he was living his life with the help of anti-epileptic drugs, but somehow due to any complication for the seizures and all, okay, in the epilepsy, this person, let's say the person stopped the medication or something like that, the person died at the age of 60 years, right? So he prematurely died in this case, because we took the example of like the person might have completed his natural death at the age of 75, but the person died at 60. So 60 to 75, 15 years he lost prematurely. So that is the years lost to life. So in total, if I will say 40 to 75 years, right, that becomes the DALY, that is the disability adjusted life years. So I hope you are clear with that. So years adjusted to life, sorry, years lost to life and the years lost to disability, okay, that is combining and making up the disability adjusted life year, DALY. I hope you are clear with that. So now I shall write that this measures health loss. This measures health loss in quality of life. This measures health loss in quality of life, right? Okay, it is also expressed as either 0 or 1, like I said in the quality adjusted life years also. But here the story is somewhat different. Here the 0 means, in the quality adjusted life years I told you 1 means perfect health, 0 means death. Here the 0 means perfect health. Here the 0 means perfect health and 1 means disability. Disability, or you can say death. Okay, so that is about the disability adjusted life, right? This is also an indicator of social burden. This is also the indicator of social burden on any community. This is also the indicator of social burden in any community, right? Indicator of social burden over any community, okay, or population, right? So we have understood about two terms, QALY, quality adjusted life years, and DALY, disability adjusted life years. I hope you are clear with that, guys.